Okay, so think about this for a second. What happens when you try to change a system where, every single decision can literally have life or death consequences? We're talking about a hospital. Even a tiny shift in how things are done isn't just an inconvenience. It can cause these huge ripples through patient care, staff morale, and honestly, an organization's ability to even survive. So yeah, let's get right into it.
So get this. This number is just staggering. When you look at major healthcare projects, things like rolling out new electronic medical records or merging two hospitals, studies show that a whopping 70% of them, well, they fail. They just don't achieve what they set out to do. That is a massive amount of wasted time, money, and energy in a field that has absolutely zero to spare. It really makes you wonder, right? Why is it so hard?
And to figure out how to fix this, we've got to first really understand the problem. So let's dig in. What is it about a clinical setting that makes change so uniquely, so incredibly difficult?
I mean, look at this. It's really the perfect storm. Picture this. You're trying to roll out some new software. Right away, you are stuck in this tug of war. On one side, you have the administrative folks worried about the budget. On the other, you have the doctors and nurses focused on patient safety. And that's just the start. Now you have to layer on the fact that this is a super high-stakes world where one mistake can be catastrophic. Then add the emotional burnout of the staff and top it all off with a mountain of regulations. See, it's not just one thing. It's how all of these pressures smash together that makes change feel almost impossible.
But here's the catch, right? Standing still, that's not an option. There are all these powerful forces from the outside just constantly pushing, forcing healthcare organizations to adapt. It means that being able to change isn't just a nice-to-have, it's a core survival skill.
And here they are, the big four pressures. First, you've got this massive digital transformation. Telehealth, electronic health records, you name it. Then there are the constant shifts in policy and regulations. It feels like the rules are always changing. On top of that, you have these huge workforce challenges, burnout, staffing shortages. It's a real crisis. And last but not least, you've got us, the patients. We've come to expect the same kind of seamless service from our hospital that we get from Amazon. So yeah, the pressure is coming from literally every single direction.
Okay, so let's put it all together. Change is incredibly hard, but it's also absolutely necessary. So, how on earth do you lead through that? Well, the answer isn't just winging it. It's about moving away from guesswork and embracing change management as a real discipline, one that comes with a whole toolkit of proven methods. And we're going to look at 3 of the big ones. Think of these as the classic, foundational models that every leader should have in their back pocket. Each one gives you a totally different way to look at the same challenge.
All right, let's start with kind of the granddaddy of them all, Kurt Lewin's model, which goes all the way back to 1947. And the best way to get it is to think about an ice cube. Seriously. If you want to change the shape of an ice cube, you can't just smash it into a new shape, right? You have to follow a specific process.
So step 1, you have to unfreeze the current way of doing things. You got to melt the ice. And you do that by making it super clear why the old way just isn't working anymore. Once it's melted, then you can move to the change phase. That's pouring the water into a new mold. But here's the part that everybody forgets. You have to refreeze it. You have to make that new shape solid so it becomes the new normal, the new standard.
Okay, so if Lewin's model gives us the simple what, unfreeze, change, refreeze, then our next one, from a guy named John Kotter, gives us a much more detailed how. This is more like a step-by-step roadmap, and it's built for big, urgent changes. It's all about coming from the top down and creating a ton of energy and momentum. And the most important part of his whole process is right there at the top. You have to create a sense of urgency. Kotter's whole point is that without that initial fire, that feeling that we have to do this now, nothing big is ever going to happen. After that, it's about building a great team, having a clear vision, and, this is so important, celebrating small, short-term wins along the way. That's what keeps people going and shows them, hey, this is actually working.
Okay, now we're going to flip the script completely. Those first 2 models were all about the organization, right? The system. Well, ADKAR says, hold on a second. An organization doesn't change. The people inside it have to change one by one. So this is a bottom-up model, and it's all about the journey that each individual person has to go on.
And this is just brilliant because it shows you exactly why a change can fail, even when you have great leadership. 8CAR is basically a checklist for one person's journey. It stands for awareness of why the change is needed, desire to actually be a part of it, knowledge of what to do, ability to do it, and finally, reinforcement to make sure it sticks. Think about a nurse on the floor.
If she's missing any of those pieces, from not understanding the why at the beginning to not getting support at the end, the change is going to fall apart right there at the bedside. It's all about making sure every single person has what they need.
So, now we have 3 really powerful tools in our toolkit: Lewin, Cotter, and ADKAR. So the obvious question is, which one's the best? Well, this is probably the most important takeaway of this whole explainer.
I mean, it's the question every leader is asking, right? You've got these different models. Which one do you actually use?
And the answer is, it's the wrong question. There is no single best model. The best leaders, the ones who actually succeed, they don't have a favorite. What they have is a diagnostic mindset. They know you have to match the tool to the specific job you're facing.
And this is exactly what that diagnostic mindset looks like in action. Let's say you're in a crisis. You have to expand telehealth practically overnight. You need that urgent top-down blitz from Cotter's model. But what if your goal is getting individual doctors and nurses to adopt a new hand-washing rule? That's a perfect fit for the people-focused ADKAR model. And for something super complex, like trying to merge the cultures of 2 different hospitals, well, you probably need a whole different tool for that, something like the McKinsey 7S model that's all about aligning the different parts of an organization. The key takeaway is simple. You diagnose the problem first, and then you pick the right tool.
Which brings us to our last and honestly, maybe our most important point. Because you can have the perfect model, the most brilliant plan, but if you forget about the people, about the human side of all this, you are absolutely going to fail. Just imagine this. You're in a big staff meeting, rolling out a new plan, and a senior, well-respected doctor stands up and says, "This is a waste of time." Boom. In one sentence, months of your work could be completely derailed. That's the reality of change. Resistance isn't something that might happen, it's a certainty.
And what's so critical to understand is that this resistance, it usually isn't just people being stubborn. It's almost always a signal of something deeper, of a legitimate concern. So that doctor who's pushing back on a new checklist, maybe they aren't just being difficult. Maybe they're genuinely worried it takes away their ability to make clinical judgments. And that nurse who seems resistant, maybe she's just completely burned out. Figuring out those root causes, that's the real key to actually managing resistance.
And at the end of the day, it all comes down to 2 different but equally important skill sets. You've got change management, which is the how. It's the logic, the plans, the tools. But then you have change leadership, and that's the why. That's the vision, the inspiration, the thing that makes people actually want to come along for the ride. You can't succeed without both. You just can't.
So that leaves us with one last big idea to chew on. In an industry like healthcare that is just always changing, maybe the goal shouldn't be to just survive the next big project. What if the real competitive advantage, the real secret to success, is to stop seeing change as this painful thing you have to endure and start seeing it as a skill, a core capability that everyone in the organization needs to master?